Hi, my name's Daniel Ray. I'm Director of Informatics and Patient Administration here at University Hospital Birmingham. And I'm talking to you at the end of the second of 3 days of our move from Selly Hospital over to the new Queen Elizabeth Hospital Birmingham. And I'm pleased to report that the move has gone really well so far, and it continues to go very well in our movement of patients from the old site over to the new site. Over the last day and a half, we've effectively moved over 300 patients from one site to the other, and we've just got a couple of remaining wards left to be moved on our third and final planned day tomorrow of the phase 1 move. There's two electronic tools, informatics wise, that I want to talk to you about today. One is the tool that we've been using to monitor the total amount of patients that have been moved from one site to the other, which is involved us taking key messages from our patient administration system, which has been updated every hour. Our second thing is the tool that's already been a piece on this week in the eHealth Insider, which is about our electronic bed management tool, our patient screen at a glance. So on this tool, I'll be able to show you how the wards are configured and how we're using it. And it's been really useful in understanding where the patients are during the move and which capacity we've got in the new hospital. So I'm just going to take you over to give you an overview of these two. This is the first tool, so you can see the patient screen at a glance. On the left hand side you can see the wards going down the left hand side that you can select. We've also got the tabs across the top. In the central area we've just got 3 columns. On the left hand side you can see the total number of patients that have been allocated bed spaces that are in there. Central column shows unallocated bed spaces, and then there's just a couple of patients on the right that have been moved into the ward areas but haven't been allocated bed spaces just as yet. So you can see the excuse me, the wards at the top that have been moved in, and then those that are due to move across towards the bottom, so you can see the bulk of the movement that's occurred. So what does it look like then? What can we look at? If we see 303 here, we can see 33 patients that's on that ward. So if you just click on 303 across the top, which I'm just going to do now, this will then effectively show the layout of the ward. So each coloured spot there you can see represents a patient. So blue effectively are the male patients, pink are the female patients, and the little squares and shapes across the bottom that you can see represent different things about the patients that we've got in our beds. So the squares that you can see there with colours in them represent the dependency levels of the patients. So the darker the squares, the more dependent the patients are. And we've also got physio indications on there, TTOs, so to take out drugs, which is feeding in from our pharmacy tracking system, so the ward can see when the drugs are ready for collection. I'm just going to show you our activity tracker. So you can see here the light green line at the bottom represents the number of inpatients that we've got in our new hospital, and the blue line represents the total number of patients that we had at our Selly Oak Hospital. So you can see the total number of patients, about the 500 mark from a couple of days ago, the early hours of the 15th, and you can see how there were some discharges that were made to try and reduce the numbers before the move. And then you can see here right at 6:30 on the 16th, which is when the move started, and you can see the drop down there and then the increase of patients moving into the new hospital. This is obviously last night where it's plateaued out, obviously where no movements occurred, and then you can see again, off we go, 6 o'clock today, and you can see the movements where the Selly Oak numbers have diminished and the increases into the new hospital, and they're approaching the levels that we would expect. And this has now plateaued off as the moves have finished for today. And we've just got the final wards that are going to move tomorrow, and then obviously this will increase further, and you can see how it's refreshed every hour across the bottom, and then we've got the days. So this tool's enabled us to track every hour the movements of the patients, also ensure that our core systems are being kept up to date as well, and that we're tracking all of the patients that we move. So I hope that's given you an overview of a couple of the tools that we've been using to monitor the tracking of the patients in the move, and perhaps I'll talk more about how the whole of the move finished, and some of the things that we're going to be looking at and very interested in a few weeks' time post-move on the next video diary. Thank you for listening.